episode of August of the Vibe Life, a hexalogue. The Vibe, that stands for Women Inspire, Build, and Enhance, is a platform dedicated to fostering women's excellence. It brings together women doctors from diverse specialities to share knowledge, leadership experiences, and personal journeys that inspire both growth as well as collaboration. There are four fundamental pillars that form the vibe: physical well being, mental health, financial wisdom, and professional excellence. Through its various initiatives, the Vibe strives to build a strong community of women professionals who uplift one another and redefine the landscape of healthcare leadership. I'm Dr. Ritu Johari, consultant diabetologist and metabolic expert practicing in western suburbs of Mumbai with a unique diverse background, decade and a half spent in pharma industry, and last half a decade practicing diabetes, thyroid, and obesity. Besides clinical practice, I also contribute to research and medical writing as co-founder of RFECT, a medical marketing agency. But what brings me utmost pleasure in sharing is the introduction of this exclusive initiative, The Vibe, as a founder of one of its kind platform that targets fostering women excellence. I'm blessed to be complimented by my husband, who's an orthopedic surgeon, and our family feels complete with a teen son and a 3-year daughter. And with that, let me introduce you to our team Y. Dr. Lotika, over to you for your introduction.
Hello, good afternoon, everyone. Welcome, Dr. Dimple, to our Wildlife Hexalog today. Thank you. We're so happy to have you here with us. Also, welcome to all our viewers today. I am Dr. Lotika Purohit, a diabetologist and lifestyle medicine physician practicing in Colaba for the last several decades. Besides that, I'm a visiting faculty at the JJ Group of Hospitals and part of the National Executive of the Research Society for Study of Diabetology in India. Also, I'm a Rotarian and which we do a lot of projects. In fact, today we're doing a health camp for about 1,000 girls wherein we're evaluating them to see their growth and other parameters. But this Wednesday afternoon initiative gives us a lot of pleasure because we speak with a new or a star speaker who is an achiever in her own right. And it's very nice to discuss and to learn about her story, what were her challenges and how she overcame them. So we're really looking forward to having a nice time with you. Now I hand over to Dr. Kavita Rane for her introduction.
Thanks, Dr. Lotika. Hi, Dr. Dimple. Good afternoon.
Hi, good afternoon.
Happy to have you here today.
Same here to be here.
Namaskar, everyone. I'm Dr. Kavita Rane. I have been practicing at Chembur in diabetes and obesity for the past 15 plus years at Rane Hospital and Apollo Spectra in Chembur itself. Apart from being the director of operations at Rane Hospital, which I run with my father. There are loads of things that I love to do. I love abstract art. I love EDM music. I love to play golf sometimes. I love to go to the gym. And the best part is this Wednesday Vibe Live with all the awesome, gorgeous girls and our star speakers. So I'm looking forward to learn whole loads from our speaker today. And over to Dr. Rukia.
Hello, good afternoon, and welcome, Dr. Dimple. Thank you for accepting the invitation and being with us today. I'm Dr. Rukia Surya Sheikh. I'm a diabetes, thyroid, and an obesity specialist. I practice in Mulund for last 15 years now. And what I love most about medicine is that it's not just about treating numbers. It's about understanding people and being a part of their journey. Beyond the clinic, I'm a wife to a medical oncologist and a proud mother of 2 daughters. And what I like to do is I love playing carom. I just recently won the tournaments also. And I love to work out. I enjoy this superb company of my friends and this meaningful conversations that we have on every Wednesday Vibe Lives. Also, along with that, recently I have discovered the joy of painting, which brings little color and calm to my busy days. I'm absolutely delighted to hear from you, to learn from you, and to grow with all of us together. Over to you, Dr. Pranjali, for your introduction.
Thank you so much, Rukia. Good afternoon, Dr. Dimple. I'm Dr. Pranjali Shah from Mulund. I'm a consultant diabetologist practicing at Diabetes Clinic. I also handle internal operations at iHeal, which is led by my husband, Dr. Kaushal Shah, who is a cornea transplant surgeon. Right now, I am, apart from seeing patients, diabetic patients, help them live longer and stronger. Right now, I'm learning NABH audits because in next few days we are having audits. So we are learning internal audits, how we're supposed to conduct trainings, and also today we have file reader also. So this is a new learning experience in my field because we see only clinical patients. But if you don't find me in my clinic, on weekends you will see me doing farming, hiking with my boys. I've also adopted a new pet, so I love. So we have two pets, so I love spending time with the pets. It's like energy for me from my busy schedule, and definitely we look forward for the Wednesdays where we learn from leaders like you. Over to you, Dr. Ritu, for the segment.
Thank you so much, girls. So, as you can see, Dr. Dimple is already here. And I must say that, when we talk gynecology, and this is what my entire book has been, when we say gynecology, unfortunately, people are still restricted to, pregnancy, childbirth, and the delivery room. But today, as you can see, we have an expert with us, not, the general gynecologist, but the one who's going to talk to us about modern gynecology. Beyond babies, beyond the delivery room, the woman who has been redefining modern gynecology. And instead, I would say that it's a privilege, Dr. Dimple, to have you here. First of all, a very warm welcome to you on the Vibe Live Hexalog.
Thank you. Thank you for having me here.
Wonderful. I have a quick question to you. So, how did you feel when you were invited first by Kavita for the Vibe Live Hexalog?
Oh my God, I'm
What
very
was the feeling?
nervous. I'm very nervous. I'm very camera shy. I told her I can't do this. I told her I have so much knowledge, but for me to, go on a stage and talk about it or, to go in front of people, it's been a little bit, I always take a step back. So I'm very nervous as a person.
Oh, well, trust me, thank you so much for doing this. We know your time is valuable, but this is something that you're going to enjoy as well. So, with your permission, may I just introduce you to our lovely audience, our viewers? So, Dr. Dimple V. Katira Chudgar is MD, DNB, FCPS, DGO, a diploma in advanced laparoscopic surgery, robotic surgery training from Harvard Medical School. She's a senior consultant in obs gynecology and reproductive medicine in Mumbai. She's a senior consultant with 23 years of post MD experience in tertiary care obstetrics, advanced minimally invasive gynecological surgery, and reproductive medicine. Trained internationally in Germany and the US, including advanced robotic surgery at Harvard, she's been at the forefront of bringing precision and innovation to women's healthcare. Currently, she is based as a senior consultant in Obs and Gynecology and the Well Women and Men Center at the Sir H.N. Reliance Foundation Hospital and other hospitals. Her work truly reflects a powerful combination of surgical excellence, technology, and compassionate care. She has extensive experience working within structured hospital systems with focus on clinical governance, surgical quality assurance, high risk obstetric protocols, ethical infertility practice, multidisciplinary team coordination. So, today, with Dr. Dimple, we look beyond pregnancy and childbirth to explore the many dimensions of Dr. Dimple herself and of modern gynecology. So, welcome, Dr. Dimple, the woman who's helping redefine gynecology, to the Vibe Live Hexalog. And without further ado, may I request Dr. Lotika to start the first segment?
Yeah. So I start with the first segment. The first segment is about the woman who chose gynecology. Now, today we know you're a great surgeon, gynecologist, but before this, there was a young woman who had a dream. Accomplished doctor has something where the story starts before the accolades come. The white coat, and what made one woman choose a specialty which allows her to witness some of life's most intimate, vulnerable, as well as moments. So let's take us. So the first question is that let's go back to rewind to the young Dimple. who has now become a doctor, but what was your dream? What started it? What made you join medical college? What made you study the curriculum, as well as what made you choose to become an obstetrician and gynecologist?
So, I never dreamt of it actually. I never thought that I would become a doctor in first place. And then to become an obstetrician and gynecologist was totally out of my mind. I did very well in my mathematics, and I wanted to become a computer engineer. Actually, I got my seat in VJTI as a computer engineer. And my father was like, no, why do you want to become an engineer? Why don't you become a doctor? Your brother is already an engineer. Become a doctor. You have equally good marks. So I was like, okay. And then I went for the admissions and I didn't get into KEM. And I was like, no, I don't want to go to, any other institute. And he was like, there is still JJ remaining. And I was like, okay. And so I decided that, and the day that I still remember the day I got off the train when I was refused the admission for KEM. I was so upset. I was so upset. I was like, I am not going to become a doctor. And my dad was like, just wait, JJ is a better institute. And I'm so thankful that I'm a part of GMC, and I took my seat in JJ, and the life has been different after that. Yeah. So
Yeah,
yeah.
yeah. Life is always different for people who are from GMC. I too am from GMC, so I know the difference. We all become GM side slowly and surely, but
Absolutely.
that's a different thing. So now, gynecology is also a very emotionally intense profession. You see birth, you see loss, fertility struggles, cancer, menopause, various things are there. Was there any patient or experience which changed the way you saw the profession?
Yeah. So, you know what? It was my own personal experience actually that changed me as a
Mm-hmm.
doctor. I was in US and I was pregnant at that time, and I was in Stanford. My maternity care was taken care by one doctor in Stanford, and somehow at 24 weeks I lost that baby. And so post that I had a series of complications which were not dealt even in a premier institute like Stanford. So then it was, that is what led me to feel that, that I should do something more than routine obstetrics and gynecology, and increase my skill set and give what women in India will not be getting, what premium institutes like Stanford cannot give.
Mm-hmm.
So yeah, I mean, that what led me to learn advanced laparoscopy. That what made me one of the first robotic surgeons way back in 2009. In I when I did my from Harvard my robotics, and that was the turning point in my life. That losing that baby was a turning point in my life.
Yeah. Yeah, I know this can be very emotionally tough times to deal with, especially a personal loss. Of course, like I said, you've seen it all. You've seen the happiness, you've seen the sadness,
Right.
and yeah, that's true. You've built a career over 2 decades. What part of the younger Dimple, Dr. Dimple, is still very much alive?
I think I still have a child in me, and I think I'm still very enthusiastic about a lot of small things in life, and that what makes me
Uh-huh.
a very happy and a content person. I'm very happy, and I feel life has been unfair for a lot of people around us. People get depressed and people get but I'm very thankful to God, and I feel very blessed for whatever I've got
Mm-hmm.
in my life. And within me, I feel that, I have that small child still within me. And me and my daughter share that very sweet bond, which I'm very happy about. And yeah, so yeah, she's 14 and she's a very bubbly teenager.
Wow.
And I really, yeah, love her for, whatever. And she also is like, she also has a very good time. So we have a very good time with each other. And that keeps he also gives me a lot of gives me a lot of joy and keeps that little dimple in me alive.
Yeah. Yes, that's it. Right? It's very important to keep the child in you alive, all through your life. And that's so nice. Now I hand over to Dr. Kavita Rane for her segment.
Thanks, Dr. Radhika. So, this second segment is about beyond babies and the delivery room. A woman's gynecological story is much bigger than motherhood. The relationship with her gynecological health begins much earlier and continues long after motherhood. So, from adolescence to menopause, what are the most overlooked chapters of women's gynecological health? What are the issues women tend to normalize when they shouldn't, like painful periods, heavy bleeding, infertility, urinary symptoms, menopausal symptoms, etc.? What do you think?
So I think, most women, they ignore their menopausal symptoms. They are, when a woman, when a girl is in adolescence, she's taken care of. A woman, when she's pregnant, she's taken care of. When she's not getting pregnant, she's still taken care of. But a menopausal woman is always, kind of, given a backseat in the household. And I think that's where most women have to understand that they have to accept that their bodies are growing old. They have to accept that the family around them have to accept that they have going to have some certain mood swings, certain mood changes. They are going to have different kinds of emotions within them, which especially the husbands have to understand and take care of the woman. So I think menopause is something which most women have to talk to their family and their spouse, and the both of them have to work together towards it.
True, true. And I believe that education plays a very important
Very
role
important
for all
role.
of us. Yeah.
Yes.
True. So,
And also because of all these fertility treatments, now you see so many women going through, menopause, perimenopause is coming very early, even women 35, 36, 37, they are going through these perimenopause, which they don't realize that they are going to get their menopause early. And, eh, men
yeah.
obviously will not be able to understand at those times.
Absolutely. So you've been specialized in advanced laparoscopy and robotic surgery. What has technology changed, not just for surgeons, but for the women on the operating table? Has minimally invasive surgery changed the way women perceive surgery and recovery?
Absolutely. I think most women now understand that minimally invasive surgery is the way to go. And most women also understand that, cutting open the abdomen is not the route nowadays that we resort to. Many women also come and ask to us about robotic surgery. So the awareness is definitely there. I mean, thanks to Chat GPT and Google Gemini, people are doing, their research. And also I feel that, when because we are doing minimally invasive surgery now since past 15, 20 years, many women know that, getting the uterus out or doing a fertility enhancing surgery is not going to be very painful, and they are agreeing for such type of treatments.
True, true. So, there are myths that exist, like too much period pain is normal, or I'm not sexually active, so I do not need a gynecologist. So, what is your opinion on this?
No, everybody needs a gynecologist from adolescence, to menopause. I mean, we are talking about cervical cancers to young girls. We are talking about cervical cancer vaccines. We are talking to them about taking care of their personal hygiene, how to take care of how to avoid rather sexually active, sexually
Transmitted.
STDIs,
Yeah.
transmitted
Yeah.
diseases. So those things are very much there on the agenda, and most women need gynecologists at every stage of their lives.
True,
And
true.
just because you're not sexually active doesn't mean that you cannot undergo a post-speculum examination, especially in again perimenopausal women, where there is a high chance of having a polyp or cervical cancers. Those are actually missed in such women.
Very true. Very true. Like a quick one. What is the funniest, wildest diagnosis you heard from a patient? Who came with you with the symptoms?
So I have so many doctor patients coming here telling me, Madam, I can feel my, round ligament. I can feel my ovary. And I'm like, okay, really? So sometimes, being in medical field can be a little,
Very true.
it can turn you into a hypochondriac. But yeah, I think most women should understand that those are the organs you can't really feel.
Thank you very much. And moving on to the next segment with Dr. Ritu.
Thanks, Kavita. And I think, first of all, I must say, Dr. Dimple, that, when you were answering the question of, you still keep the little Dr. Dimple, little Dimple alive, I think you still are that little Dimple. Because when you were saying 14 years daughter, I was like, "This?" so, so amazing. Kudos to you to keep that spark alive very much in every sentence that you say. We can feel that.
Thank
And
you.
then coming on to my segment, this is basically talking about the woman at the center. So as you just mentioned that today we live in an era of Google, and therefore you have patients coming and saying things that are very abrupt, and it's sometimes good also because it's kind of light-hearted comedy. You feel good that you're getting to laugh at such a time, but laugh not at the way that the patient gets disrespected, but at least yeah. So treating the condition is definitely not as similar as understanding that particular woman. These are two different dimensions when we look at it, right? And when you look at a gynecological consultation, that can actually be one of the closest encounters or most personal discussions that one can have with a woman. So behind these symptoms, most like you were saying, that women hide because of embarrassment, unawareness, fertility concerns, body image issues, relationships, career choices, and sometimes even years of silently living with discomfort. So the first question that comes from me is, how has the conversation around fertility and reproductive choices changed among today's women, given the entire modern gynecology advent? And of course, when we look at the relatability, do you see women asking different questions today to you as compared to what you used to see earlier?
Oh, yeah, absolutely. I think, fertility has, gone down a lot in today's day and age. And even if women are fertile, they don't want to have babies anymore, So I get
Absolutely.
so many women asking me for egg preservation. I have husbands coming to me and telling me, Madam, can we preserve our embryos? Because they are also scared that, whether this relationship is going to work, not work, what is going to happen. So, they are also equally scared as, nowadays I see husbands more scared than women, They are like,
Oh,
Madam,
so true.
please, preserve our embryos. We want to give a shot to this relationship, and only then we will see that, whether we want to, continue with a or even try for a
Yes,
pregnancy. So and many women are not even getting married nowadays, so they are coming and
absolutely.
asking us about egg preservation, and they are talking about how do we go through this whole journey without having too much of stress of deciding on a partner, uh,
Correct.
for the
Just because of the
biological clock.
biological clock.
Yeah,
Yeah, yeah,
correct. So,
absolutely.
and I think it's a good thing because now, when we have the technology and we can offer it to the women, I
Why
think we
not?
are taking more sane decisions. I think society is changing in a
Agree.
way. And I was recently
Absolutely.
listening to Vikas Divya Bharti. If you know, he's a teacher, and he was having a podcast with Raj Shamani, and he was saying that the whole marriage as a system is going to just go away around to 2040. And he was saying that marriage as as a system is not going to stay. So I think we all
Right.
have to be prepared for that. We all have to understand
Yes.
that men and women are going to live. I mean, they're going to co-live, or they are going to live without marriage, and they are going to have babies without marriage also. So there are a lot of things that are coming in light, and younger
Right.
generation, the Gen Zs, as we tell them, they are just not listening to us. So obviously the old wisdom, they want to do their own thing. They are like, we will do whatever our heart tells us. And I think that's why
Absolutely. Everything is changing.
everything is changing. Absolutely.
So, I totally agree. I love the way you say that, ultimately, yes, we have to be prepared for everything. In fact, we are that generation which has stood the test of time. We were the ones who were scared of our parents. We are the ones who are scared of our children. We are the ones who've seen, COVID and I don't know, wars and whatnot,
We are
everything
the
under
most
under
resilient
the.
generation. We are the most resilient
Absolutely.
generation, and I think the next generation
Absolutely.
is just so much spoon fed, and
Yes.
they are,
Agree.
and they want, the technology has helped them so much in living that they are not they have certain choices in their head which they want it to be in that manner. They're
Yeah.
not ready to
Too
compromise.
fixated. Yeah, too fixated. They're too
Absolutely.
fixated on their ideas. I totally agree with you. Wonderful. So, of course, there are pros and cons. And, while we say that, the sanity is better and they are much more practical in their approach, probably they are the answer to the patriarchy that we have been seeing for years and, struggling against. But today they are here to bash it up completely. And, when you said that, yes, men are coming here, just yesterday I had, a couple of, I don't know, it was a coincidence. All the men that walked in alone had not brought their wives because they wanted to talk about their contribution, their thyroid, their diabetes affecting their fertility with their women. So it's great that, now they have understood that there's a change in mindset, that it's not necessarily only the woman who is the cause for infertility in the family. So that itself in our society, I would consider as a big win for our people. It's a great answer. The next one being, how do you balance medical advice with a woman's personal choices and autonomy? Like we were just talking about the biological clock and career choices, or no marriage and the pressure of time. So particularly when it comes to fertility, pregnancy, and surgery, how do you balance when the patient is in front of you?
I think I tell the patient it's completely your choice, and it's their personal choice that matters. And most patients also are very, very pragmatic about the whole thing. That it's their body, it's their eggs that they want to store, or it's their sperms that they want to store, and they are very, very pragmatic, and they
Right.
have, most of them have done their research nowadays.
Right.
So I think most of them are very clear about what they want. And as a doctor, I cannot impose myself onto them. And
Of course.
of course, I cannot tell them. Most of them do come to me saying that, madam, we are okay not to store
Hmm.
our eggs or sperms. And
Right.
that's where I give them a little bit of that inkling that, somewhere, sometime, if you ever feel that you want to have a baby, would you not want to have this option with you? and
Right.
and, and many people agree, many people may not, so it's their choice completely. I think it's patient's choice.
I think I would definitely say that that's the way you use your emotional intelligence to put the patient first, their
Absolutely.
preference first, but at the same time, you ensure that you put your scientific facts out there so that, they know that tomorrow they don't say that, oh, we never knew this, or
Know about
we were
this,
not told that
absolutely.
we won't have a chance, kind of that kind of a picture. Wonderful. And what role do you think, preventive gynecology is playing in today's era? In helping women stay healthy rather than just simply treating disease, as you were just mentioning. We have so much on cervical cancer vaccines, as for small girls and boys also now. So how do you see the role of preventive gynecology shaping in?
I think, see, what we used to see cervical cancer 15 years back, now we don't see so much cervical cancer. Obviously, it has gone down. And I think I kudos to all gynecologists because they are doing a great job. They are telling the patients about pap smear. They are talking about, cervical cancer vaccine. They are doing colposcopies and, various other treatments available to prevent cervical cancer. So cervical cancer
Right.
definitely has gone down. But the flip side too is that the breast cancer has gone up, and that's obviously because of our lifestyle and our
Mm.
not doing exercises and eating wrong food. So I think what
Right.
most people now have to understand is that we are talking about metabolic syndromes, and we have to
Hmm.
talk to our patients about metabolic syndrome and how to avoid it, and how to change their lifestyle, change their diet, and prevent cancers. So I
Right.
think only by, and of course, drugs like semaglutide, which have come into the market, many people are coming and asking me for it, and many people are PCOS has changed completely because of
Yes,
semaglutide. Yeah, so
absolutely.
I think awareness has definitely gone up. I think awareness needs, there's more to be done in that area. We can do a lot more. We can,
Right,
like the way we have done for cervical cancer, I think we can do for breast cancers and metabolic syndrome
right.
also. And I think we can do a great difference to our society by talking about this.
Absolutely. I think the answer lies in increasing awareness and getting women there because clearly, yes, the number of pap smears that have been, taken up. I think similar way, if we have more and more of people understanding these things, then probably we'll be able to address that. Wonderful. Last one from my side, quick one from your experience. What is the one thing that women need more from healthcare providers? Is it information? Is it time? Is it empathy or is it empowerment? Which one would you choose as the most?
Empathy. I think TLC makes the whole difference. Tender loving care. I think empathy makes the whole difference. The moment you listen to your patient and they know that they are
Absolutely.
listening to you, they know that you are listening to them, I think half of them are treated.
True that.
Yeah.
Absolutely true. Absolutely true. Thank you so much. That was such wonderful answers and so much so from the heart. So, with that, next segment, Dr. Rukia, please.
Yes. Uh, Dr. Dimple, it's been so wonderful, to hear from you with such honesty and clarity both at the same time. So that's really nice. I'm sure, when the patients come to you, they're all like, okay, here we go, and we get clarity along with an honest opinion. No doubt about it that you're a wonderful obstetrician, a gynecologist. My segment is about the women leader that you are, from the operating room to the leadership room. So now medicine has changed dramatically, but leadership in medicine is still coming with its own challenges, particularly for women. So being technically excellent is one thing, but building a voice, earning respect in the room, embracing the innovation, and creating space for others is a complete different ball game. So to talk about that, my first question to you is, you've worked with in a very highly demanding surgical specialty. Matlab, you have super specialized in your field of gynecology. Did you ever feel that being a woman meant you had to prove yourself more?
I think yes, couple of times. I think, in a room where there are men operating, and then when a woman walks in, who is a surgeon, who is probably more qualified than them, it sometimes does create a little bit of ripples in the water. But I think we all come with our humility, we all come with empathy, we all come with understanding that we can work together and we have to work together. And as a leader, I think I tell my assistant, I have an assistant surgeon who is a man and who is a surgeon in his own right. But he does come and assist me, but and I think I make him so comfortable that there is no ego clashes over there happening. And that what matters at times, that we understand that um, all of us have our role in the operating room, and all of us are here to do good for the patient, and that matters. And yes, I think understanding and being empathetic matters the most.
Yeah, I think that's true. Sometimes these insecurities just need to be dropped and,
Correct.
just understand that we are all working together for the patient. And,
Correct.
creating that team becomes very
Very
important. So,
important.
yeah,
Absolutely.
yeah, I think, that's really wonderful. I think when it's the right team, then gender is not very important about whether you are two
But
women team or a,
patriarchy, sorry to cut you on this, but
yeah,
patriarchy does run deep in our country, okay, to some
yeah.
extent.
Hmm.
So for men to realize that, and for men to accept women who can
Hmm.
be at par to them, can be difficult at times.
Yeah.
Um, but we have to work our way through it. There's no way out.
Yeah, I think we have to prove ourselves twice as good
Uh, I don't know
For
about
them
that.
to accept orders from you? Would you say that?
I think my work tells it all. When I
Yeah, no?
when I start my surgery is when people realize that there is no fooling around over here.
Okay, wonderful. Nice. Ma'am, what has been your biggest challenge as a woman in surgical field? And what qualities have helped you navigate this difficult situations? Is it being assertive, like I know my stuff, or you just think empathy is enough, or resilience, or the ability to even say no?
I think that my biggest challenge has been, physically being able to do a surgery for 3-4 hours as a woman, because,
Okay.
you do get tired. And
Uh-huh.
what I have done is I have been very, very disciplined about my gym workouts. And, I've been going to gym for last 20 years. And I have been very, very disciplined about it, because I knew that that is where somewhere, my physical ability as a surgeon can go down. And for me to be able to operate in a operating room for 3-4 hours with that constant focus, I have to be physically fit. So
Oh,
as a GM side, mens sana corpore sane, if there's
huh.
healthy body in a healthy mind. So
Correct.
definitely that has always been my mantra, that I have to be healthy. There is no
So
way out.
yeah, I think that is something which people definitely ignore, that you really need to have the
As
strength,
doctors,
the physical strength. We are always so focused on being able to focus, concentrate, and being present, but it's
yeah,
also that probably you're not physically strong enough to cope
strong
up
enough.
with that.
Correct.
Yeah.
And as doctors, I think most doctors tend to ignore their health. Like I practice only 4 days a week. I do only Monday, Tuesday, Thursday, Friday.
Uh-huh.
Wednesdays and Saturdays is off for me. Only if nowadays, I get surgeries, I operate on Wednesday and Saturday, I finish them off. But, definitely I keep my Saturdays and Sundays off. I go to gym every single day. I mean,
Oh,
1 or 2 days barring the rest period.
yeah,
Yeah,
true. Which is wonderful. It's so nice, where you have a great work-life balance that way,
correct, correct,
and you're able to give your body time, you're able to give your work time, and then you're able to give best at both the places.
correct, correct.
Right. Uh, Ma'am, has there ever been a professional setback that ultimately shaped the leader you became?
Oh, many.
Yeah.
Many. So yeah, I mean, there has I mean I remember I used to work as a locum for somebody, and I used to do deliveries for 3,000 rupees also, and I used to also do a night for a senior gynecologist for 600 rupees. And
Okay.
from there where I am, I mean, it has been a long journey, and there have been a lot of setbacks. I mean, I have taken, but I think, you don't have to look at those setbacks. What you have to just learn and go ahead and go ahead and, continue telling yourself that, this is not going to bring me down. It is.
Okay. So,
So, yeah.
So, ma'am, that brings back to the part two of my previous question. Which quality did you think helped you to navigate these situations? Was it the assertiveness that, okay, or was it just being empathetic or resilient that, okay, this too
I
shall
think
pass,
resilience.
or you decided
Resilience.
this is it, I will start saying no, I'm no more going to give my services at such less prices. And yeah, so how did you navigate through all of
So
that?
I never refuse a patient, even if the
Oh,
patient does not have money. If the patient needs a surgery, I will always do the surgery. However poor the patient is, there are patients who know that madam will do it for us, and I have never refused a patient for money. That is one thing. But my resilience, my perseverance, my discipline has helped me all through. And I think when you're kind, I think that's the most important thing. When you're kind, God always repays you. God will never, the kindness never goes away. It
right.
never goes waste.
Uh-huh.
So I think, any kind of patient coming to me, I will never refuse the patient. And, patient will even put 100 rupee note on my table and say that, madam, I cannot afford more than this. And I'm like, okay, it's fine. So I definitely have learned it, that my kindness has always repaid me in bigger ways.
Right, right. Wonderful, ma'am. Truly what a leader that you are. It just shows that. It's so nice. Ma'am, one last thing. from me, how important you think is mentorship and sponsorship for the next generation of women surgeons and gynecologists?
Definitely very important. And in today's day and age where things are going so haywire, and with everything that's happening for the medical fraternity, my heart goes out to the younger generation. I would, in my capacity, definitely try to provide mentorship to them and tell them in whatever ways I can to not lose their focus on why they have become doctors, and not lose the kindness, and not lose out on the resilience and the perseverance part of it. But it's definitely difficult for the younger generation. It is definitely a very hard path that they have chosen, and we as senior doctors definitely can help them, can mentor them, can show them the right way.
Ma'am, you think the doctors have changed or the patients have changed?
Both, I think both.
Yeah.
Because of the patients, the doctors have changed, and because of the doctors, the patients have changed.
Right. So, right, it's a truly chicken and the egg story there.
Execution, yes, absolutely.
Yes. I think we all need to just pause, reflect, and then move forward. We are
Absolutely.
all in this rush of reaching somewhere,
Somewhere,
and then
and
we do not have the patience to have people along with us.
correct,
Right.
correct.
Mhm. Thank you so much. It's been so
Thank
wonderful, Dr. Dimple, speaking to you. And lovely. Thank you so much. And over to you, Lotika, for your segment.
Yeah, hi. So I think this is my segment.
Sorry,
What you do this
Pranjali.
first?
Yeah.
Yes,
मुझे याद है,
Pranjali.
मुझे याद है.
Uh,
Yeah. So, Dr. Dimple, it is lovely listening to you. And it was like a reconnection sometimes because of the busy schedule. We really forget to take a pause. Like today, as I was giving my intro and I was telling there are too many things about the NAPH admin and all happening. And I forgot my name, while I was giving my introduction. So that is happening, and we really, as a doctor, as a female doctors, we are managing so many things, hospital, kids, and we need to take a pause. So it's a good learning from you today, and it's a realization for me. So today, my next segment is about audience ask. It's a very famous segment now. So, according to you, post 40, what should be the gynecological checks for female, and when they should go and visit a gynecologist, even if they don't have any symptoms?
I
So,
think
as you said,
every
menopausal females, they often neglect their health. We agree. And I think we all are post 40. And so, what should be your checkup time we should go and visit a gynae?
make it a rule that every birthday you go and visit a gynecologist around your birthday, have a pap smear done, get a sonography done, get some blood checks done like CA125 and routine blood test, and every 2 years mammography and self breast examination is what we teach our patients. So yeah, I mean, those are the things. Make it a point to do it every year, and I think you will be sorted.
So, it's nothing to do with the family history, nothing, right?
No,
Every year
no,
post
there is,
40, you should.
of course,
Yes.
there is family history. If you have a family history of breast cancers, or some other cancers which are related, definitely the screening time goes up.
Yeah.
But in general, I'm talking about that. If you are a normal woman going through perimenopause and you do not have any
Go
high risk
and.
factors, just do it every year. And breast, and for mammography now, see, American guidelines are different. They say every 2 years. In India, some people say every year. But also, there are BRCA genes available. You can get tested for that, and then go ahead with whatever screening you have to do. So there are multiple ways you can go about it.
Yes, so definitely, I think we should promote this for all the female doctors as well as when we are consulting our patients who are post 40. At least
Correct.
every birthday, we should ask them to go ahead, irrespective of their symptoms, get this test done.
Correct.
And one practical question: when you're handling surgeries, your families, other things, what one you can say a boundary you have set when you're handling all this thing? This is the limit. I'll manage this. How do you manage your work-life balance? Especially you said you work 4 days in a week. But what are the boundaries? How do you set? No, this is the limit. I will not tolerate beyond this, like that.
So I make sure that I operate only one patient in a day, okay? And practically I operate every day. But I also make sure that I can refuse a patient also. So I am very clear if the patient if I feel that the patient is not adhering to my timings or cannot come during my timings sometimes, or can behave a little naughty, I can tell the patient. I make sure that for money or for anything else, I will not lose my peace of mind or my sleep. So I am very practical in that sense that I will always make sure that this my timings are taken care of. I have to go to gym for 1 hour in a day. I have to go for that. I make sure that I keep one operation in a day, and I'm mentally not very tired to see my OPD where I have 20 patients sitting and I have to give my best to them. So
Yes.
if I'm tired from my morning surgeries, I will not be able to do my evening OPD, afternoon OPD. So yeah, and I make sure that I'm home by 6:37 in the evening with
Yes.
my child.
Perfect. I think the setting the priorities and timetable
Is
helps.
very important, yeah.
Yes, yes. Excellent. And what do you think? One, females normally they often neglect their symptoms. Like what is the commonest symptoms you have seen in your OPD? The patients normally they have symptoms, but they neglect or they're hesitant to talk to their doctors.
I think most patients, they neglect bleeding, any sort of bleeding. They say, oh, chal raha hai, 15 days se chal raha hai. And they don't realize that, there is, you're having bleeding for 15 days. Why are you not seeing a gynecologist? It's very important to see gynecologists and figure out what's going wrong. Also, many patients are not realizing that they are putting on weight. Weight management has become so much of a problem in today's day and age. And mothers also don't realize that their child is putting on so much weight. They do not take corrective steps early, and then they come with adolescent PCOD, where the child is so overweight, and there are so many issues already present in the child. So I think many women need to be educated and made aware of the fact that the moment you start putting on weight or you have symptoms like bleeding, usually what happens when you start putting on weight, your thyroid goes haywire, your thyroid and your sugars go haywire, your bleeding starts, and the body gives you those signals, but most women ignore it.
Exactly. I think, yeah, I think that is very important. Like, even if the smallest symptoms, you should not ignore and you should not feel, Arey, chota sa hai, what they will think if I'm asking them. So, when it
Correct.
is the smallest problem, don't think what others will judge about you, right? You should just go and share your complaints and problems.
And I think preventive medicine is something that, we have to talk more about rather than,
Yes. Yes.
treatment. Preventive medicine, nobody is speaking about. When I tell my mothers and who come with their PCOD girl that, why are you letting her put on weight? Why are you allowing her to eat Maggie and pasta? Why are you not giving her, why are you not instilling good habits where the child is not allowed all these food in the house? Why are you bringing those things in the house in the first place?
Exactly. Amazing, ma'am. Now we are moving on to the next segment, which is segment 6. And now we are going to change our gears. It is a rapid fire round, pulse of life. You need to quickly answer from without thinking much. What comes in your mind first, you can just give me answer. So let's start with the first question. Periods, blessing or monthly plot twist?
Blessing.
Robotic surgery, or old school surgical skills?
Robotic surgery.
Thank you. If our uterus could talk, what do you expect it to say it to you?
Be kind to me.
Exactly. Early morning surgeon or midnight thinker?
Early morning surgeon.
One woman's health myth you would love to delete forever.
That having heavy period is not normal.
Yes. Coffee, chai, green tea, or neither?
Neither.
Neither. If you weren't a doctor, what would you be?
Sorry?
If you are not a doctor, what would be your another profession?
Then I would have been a computer engineer.
Okay. One woman, medical, fictional, or otherwise, who inspires you?
I think it's Dr. Firoza Parekh.
One thing every woman should never apologize for.
Setting a boundary.
Yes, that is really important.
Yes.
Yeah. And finally, if modern gynecology were a woman, what would she be like?
Me.
Excellent, superb, amazing, ma'am. It was lovely talking to you, and both the segments were amazing. Now, over to you,
Thank
Dr.
you.
Rukia,
Thank
for
you
the
so much.
closing. Thank you.
Lotika, do the closing.
Yeah.
So this is really very nice. I know Dr. Firoza Parekh is a legend and has inspired so many gynecologists with all her work. And there's a huge amount. So this is the close-up where we all say what is our learning from the episode. So my learning is that keep the child alive. That's very important, as well as what's important is to protect your time. You decide what you do, and you allocate time and then stick to that. Exercise and a healthy mind inside a healthy body is very important.
Correct.
Like our I won't say, maybe in a way, ancestors, because I think from GMC 185 years ago they said it, so I think it still holds good for us. Dr. Kavita, what is your takeaway?
So there were so many things I learned today. I keep learning from her all the time. But today, I would say awareness, which we would be able to create for our patient, that is so much more important nowadays. So preventive gynecology, preventive care is so much more important. And also, what I
Yes.
learned, Dr. Dimple said, is kindness. So I'm an advocate for kindness. I love that aspect of what she said. Also, what she was mentioning about perimenopause, where pap smear, even if you don't have an issue, just go and get it done, like the pre-birthday, sort of a ritual. So I love that aspect of what she said. So yeah, thanks.
Dr. Rukaye?
Yeah, so I agree completely that keeping the child alive, the curiosity alive in you is extremely important to enjoy the little things in life. So, making sure that you're physically healthy is extremely important to get through your day. So,
Yeah.
that is something which, and creating boundaries. I love your work-life balance. मुझे भी 4 दिन ही काम करना है. I think I am getting inspired there. Okay. So, but creating boundaries and keeping your time as many hours that you want to do, but creating that and sticking to it, and people will come who can come to your times, and others who don't are happy to go to others.
Correct.
That's so true. That's so true. Dr. Ritu?
So I guess I just love the way she meant that she prioritizes something. So for years together, I have been an athlete, but then being a workaholic, I completely stopped exercising, became a kind of a bookworm, workworm, whatever you call me. And always I used to struggle finding time, and I had that reason ready, not going to the gym. But now I have learned that no, that's what I need to prioritize if I want to stretch my years ahead. And that's what I love the way you said it, because whether it's about creating boundaries or prioritizing yourself, ultimately, unless you are going to be healthy, there's no point of anything else in life. So I guess that is something that I really love. And of course, yes, a lot talks about the way you speak, the way you talk. You are very clear, very focused. If not this, not that, because in life we also need to set examples for our Gen Z's, that they are very fixated. For example, I was talking to my brother's daughter yesterday. She's like, I don't know. I want to do only this. I want to do only this. But that's not how life is going to serve you. So you have to be ready for anything and everything that, the life throws at you. And you should be ready for that. So I think that is something that I really saw from your gestures. And I love that. So thank you for that spirit.
Thank you.
Dr.
Thank you so much.
Pranjali?
Yeah, so my takeaway, main thing is TLC. And I will never forget that, tender love and care, which is like Whenever I'll remember TLC, I'll remember Dr. Dimple. And whenever I remember Dr. Dimple, I'll remember TLC. It's amazing. Yes. And set boundaries. That is very important. And prioritize your task, which I need to learn and I need to work more on it. So thank you so much, Dr. Latika.
Yeah. Thank you so much, Dr. Dimple. This was really very
Thank you.
nice, very
Thank you so much.
insightful for all of us. Now we can
Thank you.
end with our signature closure. So you can put your hands together, both your fingers together. And at the count of 3, we say, be the vibe. Already?
Yes.
1, 2, 3. Be
Be
the
the
Be the
vibe.
Bye. Hope you
Thank you.
enjoyed the episode as well.
Had fun.
Yeah.
You were just
Thank you.
amazing,
Thank
ma'am.
you so much. I had so much
Yeah.
fun. I had so much fun.
Same
Thank
here.
you. And thank
Thank
you
you
for
so
your
much.
time.
Thank
you so
Bye.
much.
Bye.
Yeah.
Bye.
Thank you.
Can we stop the recording, Nandkishore?
Recording stopped.